We have a wonderful staff. Every single person at Florida Wild, their goal, take care of the client and take care of the pet. Treat them as if they were our own.
Rosie was here for a routine spay procedure, and what that basically means is we're going into her abdomen to take out the ovaries and the uterus. And this is a very common procedure, probably one of the most common that we do, but it's also relatively invasive, so we take it pretty seriously. And every patient that comes in gets an examination the day of. We have to prep for surgery here, just like a human surgeon would for surgery on human beings. So we sanitize all of our equipment. The surgeon will also prepare. So typically we're going to scrub in, we're going to use the safest that it can be for your pet, just like you would do if you had a human that was going to have a surgery. Before the procedure can begin, we have to induce anesthesia in the pet. So that's given to basically very quickly and smoothly take them through the planes of anesthesia to the point where we can place a tube into the airway to help maintain the ability to breathe for the patient if needed, but also as a means to give oxygen and anesthetic gas to the patient. The nice thing about the type of gas that we use here is that it is not metabolized by the body, it's controlled by respiration. The anesthesia is much safer now than it has been previously for pets. We'll use an intravenous catheter to help maintain normal blood pressures under anesthesia. We also use that as an access port. If, heaven forbid, there's any complications, we have a way to get medications into your pet right away. Once the patient has been induced into anesthesia, the nurse is hooking up all of the monitors, the surgeon has scrubbed in and is now prepared to enter into the surgical field. A sterile drape is used and an appropriate opening is cut into that. What that allows me to do is place it over the patient, so now everything that I touch is sterile. The surgeon is really just looking at the surgical incision and whatever is inside of that area. The nurse is looking at the top end of that, and that's why we have two sets of eyes.
Sometimes key relief.
There are very few procedures that we actually anticipate a high level of blood loss. Our goal is to have minimal blood loss, and for most things that's very easy to do. When pets are done with their procedure, we'll decrease the anesthesia and just have them on oxygen while they're waking up. Most of those pets stay in the hospital for at least the afternoon for us to kind of just make sure they're coming around okay, that they're not hurting, that they're not having any complications or problems. And then for a typical routine procedure, the pet may go home that night. And then we'll ask you when you take your pet home to please monitor for any swelling or pain at the site, any excessive bleeding, and then to keep your pet from chewing or licking at the incisions. Patients for something like a spay or neuter are typically going to come back to see us anytime between 7 and 10 days after the procedure, maybe up to 14 days. It just kind of depends on the pet.
You want me to bring you down Dr. Schrager so she can feel and make sure you're okay down there?
In the meantime, if you have questions immediately following a procedure, you have access to our emergency line up until 10 o'clock at night. You also get the surgeon's email so that you can ask any non-emergent questions. And typically you're going to have discharge instructions sent home that go over things like eating, what to watch for on the incision, and what medications to give and when. So if we catch things early and we make sure that the whole team, that includes the owner, are all on the same page with what to watch for, then we're going to avoid most of those complications.
It's about providing the absolute best possible care we can for every pet that walks in the door.